The MFT has an ethical duty to make known the following financial policies, with the exception of A. The use of collection agencies established for non-payment. B. The duty to provide reasonable notice to fee changes during treatment. C. The fees for cancelled or missed appointments. D. The appeals process for obtaining denied third-party payment. Which of the following procedures takes the impact of the church and the school on adolescents and their families? A. Family sculpting. B. Multigenerational transmission. C. Family mapping. D. Genogram. Nonverbal communication is as follows when compared to verbal communication. A. Continuous and linear. B. Easier to understand and interpret. C. An inaccurate depiction of feelings. D. Less intentional. Which of the following statements regarding the MFT's obligation to report is true? A. The therapist must report all suspected and proven cases of elder and child abuse. B. The therapist must decide on a case-by-case basis when reporting suspected elder or child abuse. C. The therapist must obtain a third-party assessment to determine if suspected cases of elder or child abuse should be reported. If the AAMFFT Code of Ethics established a professional conduct standard greater than that required by law, MFTs reply with the knowledge that A. Law and regulations exclusively dictate MFT's professional. B. The AAMFT Code of Ethics exclusively dictates MFT's professional standard practice. C. Both law and the AAMFT Code of Ethics govern the practice of MFTs, but the standards dictated by the code supersede those dictated by law. Therapists are required to confirm all of the following at the beginning of each teletherapy session except the client's. A. Level of safety. B. Location. C. Payment. D. Identity. Which of the following techniques can be applied to intentionally pay non-judgmental attention to the awareness of present moment thoughts, sensations, and feelings in order to alter client perceptions? A. Flow. B. Sensate focus. C. Hypnosis. D. Mindfulness. The kind of termination in which the therapists direct the patient to specialist services to best satisfy the patient's needs is referred to as A. Therapist-initiated termination. B. Client-initiated termination. C. Forced termination. D. Premature termination. In order to address her son's anxiety and school avoidance, the mother of a 10-year-old boy visits therapy. The mother responds to the youngster each time the therapist questions him. According to Salvador Minichin, this family structure is A. Enmeshed. B. Symmetrical. C. Complementary. D. Emotionally fused. Which of the following theoretical orientations would a therapist most likely adopt if they work with their patients to set treatment plan goals based on their best hope for a positive outcome? A. Psychoanalytic therapy. B. Solution-focused therapy. C. Exposure therapy. D. Structural therapy. The mental status examination's main goal is to A. Confirm or refute diagnostic impressions and hypotheses. B. Deliver insight into the client's risk and protective factor. C. Provide a snapshot of the client's presentation at a specific point in time. D. Offer a subjective account of the client's clinical state. A crisis event includes all of the following elements, with the exception of A. Functional impairment. B. Psychological distress. C. Disruption of disequilibrium. D. Failed coping mechanism. Which of the following states forbids the deliberate payment of remuneration? To create business involving any services payable to government health insurance programs such as Medicare or Medicaid? A. Anti-Kickback Statute AKS. B. Mental Health Parity Compliance Act MHPCA. C. False Claims Act FCA. D. Stark Law i.e., the Physician Self-Referral Law. Which of the subsequent Bohemian concepts manifests as a self-fulfilling prophecy? A. Differentiation of self. B. The family projection process. C. The nuclear family emotional process. D. The multigenerational transmission process. Studies that use quantitative methods include those that A. Conducted in a subject's natural setting. B. Subjective and process-oriented. C. Tentative in their conclusions. D. Deductive in nature. MFTs in supervisory positions must avoid acting in a way that betrays or undermines supervisory trust. Which of the following strategies will help you avoid this habit the most? A. Professional boundaries. B. Emotional barriers. C. Non-abandonment. D. Dual relationships. All of the following are social justice principles except A. Participation. B. Rights. C. Access. D. Equality. Which of the following personality traits best predicts suicidality? A. Creative flow. B. Perfectionism. C. Religious beliefs. D. Introversion. Which of the following is utilized at the beginning of treatment to emphasize legal and ethical standards and establish the roles, duties, and expectations between the client and the counselor? A. Confidentiality agreements. B. Therapeutic contracts. C. Safety contracts. D. Treatment plans. In accordance with the DSM-5, all of the following, with the exception of A. Impaired social communication. B. Restrictive or repetitive patterns of behavior. C. Fear or anxiety specific to social situations. D. Deficits in social development. A court orders a therapist to testify and provide medical data for a current patient. Which of the following statements about a subpoena is true? A. It does not require the client's consent to testify in court and release medical records. B. It requires the client's consent to testify in court and release medical records. C. It requires the client's consent to testify in court but mandates the therapist to release the medical records. People who work in the mental health field are thought of when it comes to child abuse and neglect. A. Observants. B. Voluntary reporters. C. Mandatory reporters. D. Character witnesses. Client discrimination. A. Client advocacy. B. Dual relationships. C. Patient-client confidentiality. The systems theory's central tenet is that it sees the human mind as A. Complex. B. Primarily shaped by one's environment. C. One-dimensional. D. Primarily shaped by genetics. Which area of social justice advocacy entails the development and promotion of laws and regulations intended to address social injustices? A. Social political advocacy. B. Systems advocacy. C. Community collaboration. D. Community negotiation. Why could a dual relationship be detrimental to a client? A. Because counselors should never provide services to clients who they share mutual friends with. B. It violates the code of ethics to provide counseling services to a client who is friends with the counselor's family member. C. Because they are sexual relationships. D. Because they can cloud the counselor's objectivity, which can impair the client-counselor relationship. A 22-year-old patient with auditory hallucinations and paranoid delusions has no symptoms today, flattened affect, monotonous speech, not returned to work, and gained 15 pounds. What is the most likely diagnosis in this case? A. Brief psychotic disorder. B. Schizophreniform disorder. C. Schizophrenia. D. Disorder. When collaborating with clients in establishing treatment plan objectives based on their highest likelihood of success, therapists frequently utilize an interdisciplinary point of view. A. Exposure therapy. B. Psychoanalytic therapy. C. Structural family therapy. D. Solution-focused therapy. Which of the preceding assumptions concerning the MFT's commitment to disclose is true? A. The therapist must report all suspected and proven cases of elder and child abuse. B. The therapist must decide on a case-by-case basis when reporting suspected elder or child abuse. C. The therapist must obtain a third-party assessment to determine if suspected cases of elder or child abuse should be reported. Which of the approaches that follow can be implemented to proactively pay empathetic attention to the awareness of present-moment beliefs, experiences, and feelings with the intent to influence client perceptions? A. Hypnosis. B. Mindfulness. C. Sensate focus. D. Flow. Which academic theorized that young children establish connections with the primary providers who supply them with collision and bodily reassurance? A. John Bowlby. B. Erik Erikson. C. Harry Harlow. D. Sigmund Freud. Behavioral expressive psychological treatment, an instance of cognitive behavioral treatment, was established in the years 1950 through A. William Glasser. B. John B. Watson. C. Albert Ellis. D. Aaron T. Beck. The initial narrow implementation. The approach was devised by A. Murray Bowen. B. Carl Whitaker. C. Gregory Bateson. D. Milton Erickson. The theoretical methodology laid out by Whitaker is characterized according to A. Abrasive, vulgar, and unpleasant. B. Powerful, aggressive, and terrifying. C. Impulsive, restrictive, and opinionated. D. All of the above. According to narrative professionals in the field, conflicts emerge from A. Routines for raising kids. B. Positivity defeating emotions. C. Unsuitable parenthood influence. D. Social as well as customs from culture. In the context of intimacy-based medical treatment, sexually coefficient A. is an established characteristic. B. require exceptional capabilities. C. is untainted by intrinsic pathology. D. inevitably pathological. There are basically two primary classifications associated with personality assessments. A. Self-reported information and preemptive. B. The process of stock-taking and evaluation. C. Intermittent and sequential. D. Equally introverted and extroverted. The active malinger is capable of being differentiated from a factitious infection through examination for the following things. A. The symptoms and indications. B. The presentation's brevity. C. The force that drives underpinning. D. The standard procedure of applying for helpfulness. The sentence that follows is the explanation of the adage: if they're contemplating self-harm, they're unlikely to choose to make a move on it. A. An established truth. B. Generally true. C. On rare occasions accurate. D. Unfounded. Decompensation to a certain degree of loss of competence for self-care measures is affectionately referred to as A. Considerations of suicide. B. Cognitive dysfunction. C. Musculoskeletal interdependence. D. Serious degeneration. The behaviors that follow are recommended to be undertaken by therapists when uncovering the opinions of a group and necessities. A. Permitting prejudice personal get in the way of things. B. Expecting data that is unsupported by research. C. Each participant's distinct preconceptions. D. All of the above. Solution-focused therapy, as opposed to other family therapy methodologies, points out A. Attempted solutions that aren't working. B. Pathology underlying the problem. C. Solutions that have worked in the past. D. Interactions that maintain the problem. Families that dispute on the best way to raise children often seek guidance from their families during the various phases of the familial life cycle model. A. Stage 5, launching children. B. Stage 3, families with young children. C. Stage 2, the new couple. D. Stage 6, families in later life.